Hi, thank you for tuning in to African at the Hub. Okay, so today we continue on the topic of mental health. The challenges of mental illness is staggering. We, those from Africa, the issues are always about the stigma that we put and the discrimination that we associate with mental illness or the condition of mental health. It's just not encouraging enough. The challenges of mental health can be very devastating if the person suffering from it does not get the help that they need immediately. So today I'll be talking about some signs that we should watch out for, especially among children and youth. Mohammed Osman is a writer on the taboo of mental illness in Kenya. Mohammed Osman concluded that many people see mental illness as a spiritual rather than medical disorder. And for that reason, many patients go untreated. Victims can seek treatment both the spiritual way and the medical way. In addition to Osman, Eugene Lee Davids also finds that government intervention is necessary to improve child and youth or child and adolescent mental health on the continent of Africa. If we do not embrace this idea that mental illness can be treated both spiritually and medically, then there is always going to be the stigma associated with this condition. Now, I always say that mental illness is colorblind. And as it's colorblind, it's not influenced by any religious, racial prejudices. This is why this topic needs to be taken seriously. As we are praying, and also add the medical support to it, so children who are suffering from this can still enjoy their childhood. Here are some signs of mental illness. Many children and youth will show different moods, thoughts, and behaviors at various times as part of normal childhood development. But these signs, the signs to show that perhaps there could be a sign of mental illness, so when a child is getting significantly low mark in school. Okay, so a child comes home with a very low mark. It doesn't mean that we should start slapping the child and say, why are you not doing well in school? Okay, so we have to start thinking, is there more to it than just a low grade than an F on the paper? Okay, so when the child is also avoiding friends and family, that could also be that the child perhaps is suffering from a condition of mental illness. And if the child is having frequent outbursts of anger, so this child is always getting angry and you try everything that this like they are quick to be angry, that could also be a sign that maybe there's an onset of mental illness. If the child is having sleeping issues, so the child sometimes is sleeping a few hours and waking up so early, or the child is sleeping at odd times, that could also mean that there is a problem of a mental health issue. And if the child is engaging in drinking and drugs, doing drugs and alcohol at a very young age, that could also mean that perhaps there is a sign of mental health issues that we should watch out for. And if the child is rebelling all the time, the child is not disrespectful, but the behavior is as if they are disrespectful, they are rebelling all the time, that could also be an onset of mental illness. And if the child is not doing the things that he or she used to enjoy, this child maybe likes to go out to meet friends and families, and now the child doesn't want to do any of those anymore. The child is just hiding out. That could also be a sign to be worried about. If the child is worrying constantly, some children will worry if their parents leave the house. That should also be a sign to worry about or something to consider. If the child is experiencing frequent mood swings, so today they are happy, they are not happy, or every 1 hour or so the mood is just changing, that could also be something to worry about or seek help for. If the child is not concerned with his or her appearance, so the child doesn't care how they look like, they don't want to shower anymore, it takes a lot of hassle to get them to keep themselves clean. That should also be something to worry about. If the child is obsessed with his or her weight, this child maybe is just doesn't care about the weight, overeat, or on the other side of the spectrum, if the child is always looking to be slim and not eat and look very skinny or lean, that could also be something to worry about. If the child is lacking energy and motivation, so oftentimes you see a child in a classroom, there's no energy to want to participate, they don't have the energy to do anything. You send them and they are just slow and tired all the time. That should be something to worry about as well. And if there's an increased risk-taking behavior, so the children just want to jump onto the road without being careful to see if there's a car or an oncoming vehicle, that could also be a sign, something to worry about. And also lastly on my list, if the child is just feeling down all the time, that could also prove to be maybe perhaps a sign of on some early mental health concerns. Okay, so these are some of the signs that we should watch out for. Also, if these signs that I have just read are intense and if they persist for a very long time, or if they interfere with a child's life, then we as parents need to take caution by seeking some form of therapy for the child. And if I say therapy, therapy can be different types of therapy. In another video, I'll give more example of what type of therapy works best for what type of mental health condition. Please, we want to hear from you. What other signs do you think should be added to this list? And also, what are your thoughts about child and youth mental health challenges? Please put your comments below and let's hear from you. Thank you so much again for tuning in to AfriCanada Hub. Thank you.